Apparently, we are rich enough to buy a lot of cars.
Somebody can afford it, why not? Those who live in Klang Valley deal with a lot of mental stress.
Healthy stuff is expensive in Malaysia.
But it's sakit orang kaya. But I also think that it's also sakit orang not so kaya.
Hello, everybody. Welcome to yet another episode of Beyond the Headlines. We go to space for the top stories that made the headlines and more. I'm Amalina Kamal.
And I'm Alina Koshi.
As we gear up for the Chinese New Year celebration next week, with the reunion dinners, the open houses, as well as the Balik Kampung rush, I think there's a sense of movement in the air, isn't it, Alina?
I think there is a movement because we are having one celebration after the other, right? But you know what? Beyond the festive mood, we're also looking at something really deeper today, and it's resilience, not just in public health. I know it's not a very festive topic, but not just public health, but in household finances and national policy.
Because why? Why public health, right, Rina? Because Malaysia currently is managing renewed tuberculosis clusters. Now, even as families prepare for the festive period, they have to consider the expenses that they're about to juggle, having to accommodate, having a merry celebration, but also to consider having to pay like the hospital bills at the end of the day because you're not maintaining certain social distancing.
I mean, it's like a shadow over the celebrations, so to speak. At the same time, the government is pushing ahead with the targeted subsidy reforms like BUDI95, aimed at reducing leakages and strengthening fiscal space. So how do these developments connect? What does system readiness look like today in healthcare and in economic policy, especially during a season, right, where social interaction is peaking?
Right. And how do we actually ensure support reaches to those who need it most while keeping both our country and economy and family steady? Of course, joining us on set, we have Galen Center for Health and Social Policy founder and CEO Azrul Mohd Khalib. Welcome, Azrul, to Beyond the Headlines.
And we also have Putra Business School Associate Professor Dr Ida Md Yasin. Welcome to the set today.
Thank you for having us. It's great to have the both of you. Before we start diving deeper into the discourse, Elena, can we just pause a little bit? I do understand because we were talking about movement earlier, right? How was traffic today for you? How was traffic?
I mean, if I had just one word to say it, actually no, I have more than one word, and not many of them can be said today, but just one word, it's horrendous. It took me hours to get here, and I left kind of late. And last night I left at 10:30 p.m. from the office to head home to Klang, and there was a traffic jam.
No, 10:30 p.m., right? I mean, you're not alone there because I also I usually leave after peak hours because I live all the way at the cusp of Shah Alam, bordering Kuala Selangor. Usually around 8 it will be okay. Traffic will be smooth thanks to Dash as well. But there was quite a bit of a congestion throughout my route.
There's a question that races through my mind because as I'm driving, bumper to bumper, inch by inch, slowly but surely heading to my destination. Sometimes I feel like I need a passport to get home, But I just see the number of cars on the roads. I mean, I don't know.
I mean, you're not wrong because the number of cars has increased because apparently in Malaysia, total vehicle sales in 2025 alone has surpassed more than 820,000 units. In January itself, it's more than 90,000. So we go to Dr. Ida. Dr. Ida, what does this signal to Malaysia? Are we purchasing things based on impulse? What's the long-term gain here? Because why are we looking at having to talk on one end, having to save for rainy days, but on the other, our spending patterns are not necessarily showing it, especially cars. I mean, cars are deteriorating assets here.
Yeah, in my opinion, if somebody can afford it, why not? But if you cannot afford it, avoid it, right? But being Malaysians, we are blessed because our country is a car-producing nation. We have Proton in early 1980s, and in Southeast Asian nation, we are the first actually produce our own car, and later followed by Vietnam. So by having that kind of a backdrop, that's one of the reasons why we have a lot of cars in terms of ownership, and in terms of the finance part of it it makes it easier for us. So you can see even the students in university also can afford a car for that matter. If you just work, for a few months, you can also afford a car because of the system, the financial system that allows us to do so. So of course, there is a good and bad. If I am the car producer, of course, I love this because I can sell and increase my revenue. If I'm a consumer, I love it too. But again, it depends whether I can afford it or not. Okay, what about from the perspective of the government? Actually, the government loves it because when the car manufacturer can produce more, they can pay tax to the government. Okay, but again, we need to look into the long-term side of it because there are a lot of cars we are going to put all this, right?
So there's a bigger question of livability then. I mean, that arises. I mean, Azrul, just quickly, do you drive?
No, I don't. I don't even own a car.
Oh, is it a conscious decision that you made?
It is. But I'm also conscious of the fact that when you look at the data concerning how much time you spend on the road, per year, the Klang Valley motorists, on average, 580 hours a year, 44 hours a month. I don't think I want to be spending my time, in that kind of. If you talk about livability, you can say yourself, you experience it.
No, because there were reports saying that, a lot of Malaysians, especially those who live in Klang Valley, deal with a lot of mental stress. And the majority part of it is just by being in traffic. And one case in point is us. Yesterday lah.
I mean, seriously, you're absolutely right. If it's 44 hours, right? Can you imagine what I could have done with that 44 hours? But I'm confined in that little box on the road, staring in front of me. I mean, seriously, we are spending literally a lot of our time, in something that's absolutely unnecessary.
Ticking time bomb. We're like a ticking time bomb waiting to happen in that sense. Dr. Ida, sorry, earlier outside of the show, you did mention in one household, how many average cars do we have usually?
Oh, that's a ratio 5 years ago. According to the statistics in Asia, we are number 2 in terms of the ratio of population to the cars. Japan is number 1. Of course, we know that Japan is also a car manufacturer.
Sorry, what was our ratio again?
550, if I'm not mistaken, per 1,000 population.
Okay.
Whereas for Japan, it's 600 something. Per 1,000 population. In this case, even South Korea is car producing nation as well, but they didn't fall at the higher category though. So that's the statistics that we can see. I'm not talking about the cars, but it is registered vehicles. That includes the bus, the motorcycle and so on. But of course, car has the largest percentage on the total amount of licensed vehicle.
Because I'm looking at some information here, right? The surge in sales, at least earlier on that I did mention, it was attributed to a robust economic performance. While it's great for the economy, we're stimulating the trade, not just domestically but internationally as well. With I think we have a lot of partners when it comes to EV manufacturing and some setting up their factories here. But I will go back to the question of livability, because you want Malaysia, as we develop, to also think about the individual, right, from point A to point B, meaning how pedestrian friendly are our infrastructures, how we can have even the freedom to not just rely on having to ride vehicle to get from point A to point B. That is what I probably miss most when I go overseas. I mean, tak payah cakap jauh lah. Just going over to Singapore, then you can just even look at your map. If it's just a 2 kilometers sort of journey, you're like, you know what, I'm just going to walk. Because it's just so convenient. Why can't we replicate it here?
We're doing it, I think. In a big city like Kuala Lumpur, we have a public transport. I mean, if I'm going to KLCC, I will not drive. I'll use public transport, the train, because it's efficient. To me, it's efficient. But I think the lacking that we have is intercity train that we're lacking on that, except that we have one, right, to Kedah, which is very famous.
But I also think pedestrian walkways, things that make, encouraging people to actually take public transport or even walk it out. We don't have enough walkways.
If we do even have walkways, we have motorcycles blocking it.
Cars.
Yeah.
Or construction.
Yeah, on construction. Or a long list of things.
I mean, it's like, so there's a lot of cars on the road. Apparently, we are rich enough to buy a lot of cars. I just want to know, Malaysians, what's your secrets? How are you doing this in the midst of inflation and rising costs? We still manage to buy cars.
Well, some would say that inflation for us is still very relatively low because ours is like below 2%, right? But then that's not even an excuse. The excuse is like, I mean, if you're gonna look at dollars and cents, actually we should. Personally, I think we should invest more in the infrastructure by having those intercity sort of gaps be reflective of what the city is trying to push for, meaning having to have accessibility, not just in terms of the information we get or the service we offer, but in terms of mobility, movements.
I mean, if car sales, right, is often seen as a barometer of consumer confidence. So what does it tell us about Malaysians, how Malaysians are feeling about the economy right now? Are we looking at genuine long-term growth? Or could this be a
buy now before price change?
I think we are at a good position though. All the expected gross domestic GDP growth, in which it measures the income of the country or the wealth of the country, is expected to be around maybe 4%. But of course, in this year 2026, there are going to be some challenges where we have these geopolitical issues. They probably have some sort of going war to be in the Middle East between Iran and US, and it will disrupt actually the supply chain for that matter and international business. So that's a thing that coming, but it's not happening yet. So as of now, I think we in Malaysia still enjoy whatever we enjoyed last year. So I agree with Malina, the inflation is being announced. However, the price of car is not included in the basket of goods measuring the inflation of the country.
Interesting. I mean, just for fun, because when we talk about the whole buy now before price increases concept, right? In the context of, because we're talking about the traffic situation here, we have seen a lot of promotions having to get yourself an EV, at least before taxes come in, quickly before we go into the next segment. Is EV even popular?
It is gaining popularity, I guess. But when you say buy now, don't regret later, this is all phrases used by the marketers. Because if you are marketing a certain product, of course you are going to entice, the customer to buy from you. So we'll say anything like that.
But I like what Azrul said just now before the recording, right? He said that the real test of an EV is when we take it during the Balik Kampung Exodus. When a trip that takes 4 hours ends up being 11 hours, we want to know whether you can take your EV safely to your destination. So that's the real test.
Yeah.
Right?
Because all this while it's just being probably the pilot testing is not necessarily reflective of real realities today. Anyway, if you talk about traffic, it's going to stress us even more because I'm already making mental calculations like how soon should I go back now, because probably you have to add an extra hour so you can actually enjoy that half an hour just of like being at home, having to decompress before going to bed. Now it's like, oh gosh,
it's like meticulous planning. Before we leave, we do some mental calculations over the calculator. How many hours will we take? What's the best time?
Yeah. I mean, okay, since we're still talking about Chinese New Year, festive gathering and everything, I do want to note about how we should also consider public health here, because the ministry has just reported over 2,500 TB cases and several active clusters to date. I mean, it's not headline grabbing like COVID or even the traffic situation having to, from 1 hour become 2 hours in terms of traveling time. But still, it's serious enough to get our attention because I thought TB has been eradicated. I thought we had it all under control. So we move our attention to Azrul, right? How serious is this situation really?
Tuberculosis is not a new disease. It's been around for eons. In fact, if you look at the history of TB, you'll find that the ancient Egyptians had massive outbreaks of TB. Back then, you see in the mummies, in the bones of these mummies, you'll find that this Mycobacterium tuberculosis, which is the bacteria that causes tuberculosis in those bones, and you will find that in countries like Malaysia, where it may sound as if it's been eradicated or eliminated or something. But in reality, it's actually there in the background. It's endemic to the country, and it will, once occasion, you will find that there will be clusters that are coming up. And basically, it's just part of the landscape of diseases that are in a particular country. But I know for a lot of people, because Malaysia is now basically coming up to be a developed country, you think that this is more of a less developed country disease, but the fact is it's still very much there. And for the states, you'll see a lot more cases, say in Sarawak, where they will have more prevalence and also mortality of TB compared to other states. But yes, it's quite serious. We see quite a number of active clusters per year, but this year is particularly worrying because the recent information provided by the Ministry of Health already indicates that there are already far more cases, around more than 200 more cases in this period of the first month of 2026 compared to the same period last year. So we are expecting there to be a lot more active clusters and cases of TB amongst the population this time around.
I just want to give a little bit of history lesson to our audience, not because I'm a historian or whatever, but this is just what I managed to dig up from the internet. But of course, Azrul, correct me if I'm wrong. Malaysia in the past has been tackling TB for decades, starting with sanatoriums and early vaccination programs. Do you think we should, have a look at these efforts again, and how can we roll it out better?
Well, it's the pathogen here is the bacteria, which is Mycobacterium tuberculosis, and the symptoms as well as the long incubation period for this particular disease makes it hard, really, in terms of prevention and control, which is why you see these outbreaks occurring. It's almost like a peat fire, slow burns in the background. It's there, but it's not really present, and it's not like a wildfire like COVID-19. It was more like a wildfire, so it was like merebak all over the place, right? But when you see the way that the disease is managed, you'll find that almost every child in Malaysia starts off with the first 100 days with a series of vaccines under the National Immunization Program. And everybody knows the BCG, the Bacillus Calmette-Guerin vaccine. Yes. You get jabbed,
Got some scars.
Yeah, got some scars there and everything. But basically that helps to provide a protective immunity against the bacteria. So it prevents you from actually contracting tuberculosis and suffering from serious disease, right? So the problem with that is that when you had that during your childhood, it doesn't provide sufficient efficacy or protection once you're older, especially if you're elderly. So you can assume basically at some point in your life, you won't have any protection from, that vaccine anymore because you will get a contract TB. But also when you look at the symptoms, it's long cough, long periods of coughing, 3 weeks or some other day, coughing blood. You maybe lost a lot of weight and very fatigued and so forth. These are symptoms that maybe, just waved off as just nothing extraordinary. It's just maybe you have contracted something from coming back from Hajj or Umrah, or you go abroad and you come back and you're still coughing, and you don't really take it that much seriously. So what's happened here is that you have people who are quietly acting as
agents. I mean, what do you call it?
Super
spreaders, basically. They're like vectors, but basically they are themselves spreading in their families, in the congregations, having dinner at night, or attending school, working in the factory, working in the workplace, air conditioned especially, when you're in closed environments, around 80% possibility of spreading. And the problem here with this particular bacillus, this bacteria, is that it's aerosol, meaning when you cough, when you speak, when you sing, it can actually result in these droplets, these aerosol droplets, to be in the air, and it will be there for several hours. And this is in indoor, of course, and you can spread it and you can contract it that way. And you can end up with this disease, which results in you becoming more and more fatigued as time goes on. But also you may not know that you have TB. and this is where it becomes very hard for people to understand. We see clusters of infection, active clusters, in places of work, in factories, in dormitories, and even in places where there's a lot of people gathered, like the recent Taipusam celebration activities. These kinds of community gatherings will result in there being an increase in transmission.
So I just want to say, because because we're talking about TB clusters here, right? Well, when you talk about clusters, people can panic, and some might think that it means that the disease is everywhere. Should Malaysians actually interpret it as a contained case? Because as what you've just described, it might not even be that. It might not even be contained if we have this sort of nonchalant attitude about our symptoms. How should we go about this?
I think we have to first understand what do we mean by the word cluster. Now, the cluster really implies that at least one or two persons have been infected and they're in close proximity, but also there is a contact tracing that has established that infection occurred between two, but also possibility with other people in a different context where you are working or in a workplace or some other, and there is the possibility of aerosol transmission there. That's a cluster. So a group of cases there constitutes an active cluster when they are actually also potentially putting, or there is a risk of infecting other people. And this is what we look out for. And once you know one case, what you need to do is do contact tracing. So you do contact tracing to find out where this person has been, spoken to who, come in contact with whom, could possibly have infected who. And that's why we talk about these clusters. And unfortunately, I think we've been told that there's maybe around, 10 active clusters TB right now.
10 to 15, if I'm not mistaken.
Yeah.
I might have to
Across the country,
yeah.
right? There's Johor, Kedah, Kelantan, Pahang, Perlis, and even Sabah, it seems. But these are the ones that we know about. The
But what
ones
about
that
those that are
we do not know
underreported?
about,
Yeah.
which is not yet been detected or diagnosed.
But I also think that when we talk about clusters, you are talking about like a contained thing where it's in one place. But we spoke about this just now, and we talked about several terms, like for example, an endemic. So this is considered an endemic, I would say, right?
Well, the TB is endemic to Malaysia.
I'm sorry, not endemic. What's the other word for
Epidemic.
it? Epidemic.
Yes,
Correct.
so it is an
Yeah.
epidemic. I mean, one or two outbreaks which are located, confined to a geographical location, then we call that a outbreak. But once it spreads to, say, other states and there is a pattern there, then we start calling it an epidemic. So, outbreak, epidemic, endemic, and then pandemic, which is, what everybody knows now because of COVID-19.
Do you think that there's going to be a bigger sort of trend in terms of a spike when it comes to tuberculosis?
Yeah, Emelina, I'm actually worried. It's just like what Elena mentioned just now. We are coming up to a point in time right now where I get deja vu vibes from the COVID-19 period, because Chinese New Year is just around the corner, literally at the doorstep. Ramadan is about to start, and Hari Raya also later on. What do these all have in common? They involve large gatherings of people doing communal things together within close proximity, with no wearing of face masks or any kind of social distancing, which we are very familiar with. Chinese New Year, obviously, because of visiting relatives, reunion dinners, and so forth.
Bazaar Ramadan,
But during Ramadan in particular, I'm very worried about, which people don't really talk about, is the congregational prayer stuff. Where there is a lot more focus on doing prayers together in congregation, and there is increased frequency of that for longer periods of time.
Right. Vigilance is definitely necessary right now.
Absolutely.
Social distancing.
Yeah, we actually have to consider putting into place some of those precautions that we were very familiar with during the COVID crisis, because infection will and can, and it definitely will occur during that period where people are praying together for maybe an hour and a half or 2 hours at night, if you remember, during Ramadan. And then later on, of course, when Hari Raya comes and people are all together, there will be a lot of mixing, communal interaction. There'll be speaking, singing, talking, and shouting, and all of which can cause aerosol to go into the air. So we are definitely looking at a spike of an incidence of cases related to TB in the next few months. It's almost certain.
Right.
I would just want to ask this question because historically, again, TB was a leading cause of death in the 1940s and 50s. I mean, now it's 2026. How much has medical breakthroughs occurred in a sense that what's the mortality rate like? Because people tend to take for granted, they think it's, like you said just now, it's just a cough, I live with it, things like that. But how can you make people realize how dangerous or how
Concerning
concerning it
the
is, with the spread of TB?
Well, the thing is, as I mentioned, it's an old disease,
Yeah.
and ever since the discovery of antibiotics, you can treat bacterial infections, and TB is one of those that we have known about and are able to treat. And we can prevent through the use of vaccinations for children, but not for adults and adolescents. And we look at the mortality rate, you'll find that it has decreased significantly for countries like Malaysia. We currently at around 7.58 per 100,000 individuals. It's actually a reduction from previous years. But when you look at some states like Sarawak, for example, it's around 12.6.
Oh, wow.
Meaning they have a higher mortality rate compared to the other states. And why is that? It's because the way you treat tuberculosis also is a little bit more complex. You have antibiotics that you can take, first-line antibiotics, which at the end of the day provide you with effective treatment for tuberculosis. But here's the thing. It is for 6 to 9 months. That is your period in which you have to adhere to treatment and you have to be disciplined enough to not default or drop out. We very often feel the moment we feel a little bit better, there's no more coughing. Okay, no need lah. I won't go see the doctor anymore.
Yeah.
But there is a reason why TB especially has something called directly observed treatment. Meaning, when you take the drug that treats TB, you have to take it in front of a doctor. Doctor must confirm you took that medication. So it's to ensure that you adhere to that and that you get treated and be cured of TB. A lot of people will not be able to do that. And in fact, Malaysia has a very high dropout rate. I think it's around 25%.
In terms of what? Continuous treatment?
Of dropouts, meaning they are on treatment and then they default. They discontinue treatment. It's around 25%.
Do we have to back when we contracted COVID and all that back during those lockdown years? Do we have to have quarantine, isolation, and things like that? Because
also 6 months is a bit too long, lah.
I mean, this is
quarantine a bit long.
This is a very important question, really, because you want to know your family members are having TB, they're coughing, the sputum, the spittle, the aerosol that comes from the mouth is very likely to be able to infect. So there is a period of infection that you are going to be able to infect other people. You should be wearing a mask. So if you know and there is a positive diagnosis of a person with TB, that person should be wearing a mask, like what we were wearing during the COVID period. But one of the things that we also have to bear in mind, especially in a country like Malaysia, where we also have a problem of antibiotics also, is the emergence, and this is what I worry about quite a bit, is multi-drug resistant TB or drug-resistant TB.
Have we seen signs of it though? No?
We have it already here in Malaysia, where the TB strains that are being treated are resistant to the antibiotics. So it's because we use too much antibiotics or we are not consistent about its usage. I mentioned just now, patients, they get treated
And then they drop out.
out. And then when that happens, it creates these resistant strains of TB. So you do not want a situation where there's an outbreak of drug-resistant TB. And that's one of the things that I worry about this coming,
year or even the festival season.
Because we have our open houses, reunion dinners, there's going to be a lot of close contact.
Oh, yeah.
Yes. So does the risk of TB transmission, right, I think we talked about this, significantly increase during festive gatherings? I think you have said that it
It
does.
does.
But we also have our vulnerable groups,
Yeah.
elderly, young children, those who are immunocompromised. So how do we ensure, their well-being during this period? We don't want to alienate them from social gatherings, but we also want them protected.
This is absolutely again, Elena, great questions here. And bringing up things that I sometimes forget about myself. The fact is that those who are most vulnerable are actually those who are older, who have pre-existing conditions like asthma, they have cardiovascular disease or living with chronic kidney disease and so forth. These are people who in these times, if they were to contract TB, it could be fatal.
Yeah.
And what we want to be able to do is to protect them, especially in terms of immunocompromised individuals, people whose immune systems are already compromised because either they're born that way in terms of congenital condition, or maybe they're suffering from SLE, and taking treatment.
Transplant patients.
Transplant patients, of course, so how do you protect them? The only way to do that really is to wear a mask. I mean, we can't ask people to isolate because, that's impossible ask in these times. So what we can do at the bare minimum is to wear a mask to protect them. So if we know that there's a possibility for us to infect other people, then for those who are aware that they have TB, to wear a mask and to be careful around that environment. But we have to take it serious. We cannot be sambil lewa atau be just complacent about it, because it will cost us more if that person becomes ill. Whereas a piece of face mask is only a few cents now, and we can just wear that even though it may look weird, and somebody will say, hey, bukan COVID-19 dah habis ke? No, actually we have to take into consideration that TB is a real threat right now.
Right. Usually, in many, many instances, when it comes to having to ensure we are safe and healthy, we're always very reactive, right? So if an outbreak does happen, I want to talk about system readiness. Malaysia has made, although, as I mentioned, strides in TB control and public health preparedness, but let's say if the TB itself is resistant to certain drugs, we have to actually relook at our strategies, right? But Dr. Ida, I just want to go to you first in terms of the financial angle, and then we get Azrul's reaction from the public health side. 2026 has seen rising medical costs above all, and households are actually having to experience a hardship in dealing with it. How serious is this particular financial strain on middle income families or low income families, actually? And then I think outside of the set, we were talking about how infectious disease does not necessarily, insurance does not necessarily cover infectious disease, even if you're able to afford insurance. Maybe we can look at how we can reform certain policies, or if not reform, instill stopgap measures first.
Indeed. So if we look at the, how do I say, not to say insurance, but medical facilities in our country, we have two tier. What I mean by two tier is, first is government hospitals, in which for us, the Malaysians, we only need to pay RM1. I mean, almost zero, I must say. If it is RM1, almost zero. You're free. We can say it is a free medical. And number two, of course, we have a certain group of people in which they have insurance. Okay, so these are the two tiers. So coming back to Amalina's question, I believe that if you are talking about those group who are maybe not capable to pay for the private hospital, they should go to a public hospital. Of course, when we talk about public hospital, I must say that we have a good system in which good doctors, good nurses, they are well trained. We are among the top in the world in terms of the healthcare service provided to the citizens. Of course, there is a setback too, because there are too long queue, of course. If you go to the public hospital, you need to wait half a day is normal, usually like that. So that's a setback of that system. But again, I think the central bank, Bank Negara Malaysia, is looking into the medical insurance, which is affordable to the Malaysians. But they are now having the white papers. You can go to the Bank Negara website. They have the white papers on that. So they are going to roll out probably next year, 2027, and of this year probably some sort of a pilot. So it is affordable in the sense that probably we need to pay the premium only maybe 80 to 120 per month kind of thing. So of course we didn't have much information on that, but this is under the preview of Bank Negara Malaysia. But coming back to the question of Malina, I believe that we can at least, or at the worst case scenario, go to the public sector hospital.
I mean, in terms of affordability to treat certain cases, but as I mentioned, the infectious disease is not necessarily even looked at even in private aspect, right? Azrul, are there engagements with policymakers or at least stakeholders in the medical insurance sector to actually look at this as a scenario? I mean, as not as something that is profitable, unfortunately, but something as like a service, because it is something that's very concerning.
It is vital.
Yeah. I actually have differing views compared to Dr. Ida on some of these points. But when you look at things like TB, for example, which is, it infects the lungs, infects other parts of the organs like the brain, bones, and kidneys, you'll find it very quickly if you were to cost it. It's an expensive disease, and one for which treatment may come up at a certain reasonable, significant cost to not just the patient, but also the payer. Contrary to a lot of what people believe, public healthcare is not free. It costs. Somebody pays for the medical treatment. It is subsidized 98% by the government, meaning us as taxpayers. It's not 1 ringgit. That is just the subsidized cost, but the actual cost behind it is being borne by someone. Private healthcare is just a lot more visible as to where you can see it. It's not just about profit making, but also in terms of where the actual costs are, which tend to sometimes mislead when you look at public health. Public health today struggles with the kind of outbreaks that we see. We've seen it during COVID.
Yeah.
We've seen it during outbreaks of dengue. We've seen it during periods in which things like TB emerge and affect specific populations, because the healthcare system, it depends on manpower, it depends on the infrastructure. Most importantly, it depends on the expertise for us to be able, and you have to be able to pay for that. So right now, what we are first and foremost trying to engage with public and private stakeholders is, first of all, to acknowledge that we have a problem, that the public healthcare system needs help. It is in crisis. It's something that we've said before COVID. It was actually mentioned by the Auditor General. It was emphasized by the Director General of Health at the time. And the government has acknowledged through different ministers that we are in crisis when it comes to public healthcare. We need a way to ensure that we fund it better. We pay our nurses, doctors, our healthcare professionals, workers better. And most importantly, because it all is about supply and demand, the demand on these healthcare services are also able to be reduced. The fact of the matter is, Malaysians are unwell. Malaysians are sick. They're living with more and more non-communicable diseases like diabetes, hypertension, high cholesterol, obesity. And this is where all of this has a price tag. So we have to acknowledge that we need to look at things differently. We need reform when it comes to the public healthcare and private healthcare systems.
This might not be a popular sort of statement, but what you just mentioned in terms of Malaysians having this sort of condition, to some extent, kalau orang-orang tua, dia cakap, ni sakit orang-orang kaya. Ni orang kaya je dapat diabetes, because it's lifestyle at the end of the day, because it's like what you eat. What you, I suppose, consume, right? And much of that is also boiled down to whether or not we have even the freedom to have that work-life balance at the end of the day. Maybe we can talk about this whole trend of holistic wellness, Azra. I don't know whether you've seen a rise in that, and whether or not, if we were to if we're not able to change certain policies, maybe we can drive our Malaysians, our general populace, to take up better lifestyle habits. Yeah.
I mean, I would totally agree. I mean, if it's about going for more pickleball, or yoga, badminton,
Yeah.
futsal, football, anything that gets us out of the house, to be active, to be able to sweat, to be able to get our hearts pumping a little bit better, but more to burn fat and so forth. We should do that. It's the cheaper option to what we're doing today. Today, what's happening is that we are paying for diseases. We are paying the treatment of diseases, and it's the most expensive way to do healthcare. Let me just mention to you the biggest problem that we have for Malaysia is diabetes. Today, around 15.6% of the population are living with diabetes, whether or not they know it. Diabetes is costing the taxpayer 3.9 billion ringgit. And when you compare against cancer and cardiovascular disease, diabetes is the highest in terms of payment. So how do we go about doing better? We have to prevent the demand. Remember, I mentioned about supply and demand. We have to reduce the demand of people needing to go to hospital, needing to go to the KK, the Klinik Kesihatan, for treatment. If we do that, then we can all get better. And if it means looking at wellness, looking at mental health, looking at being more active, to engage at the youngest possible period of people's lives to get used to being active, that is the better way to go about it. But I can tell you, when you look at the numbers, it's not very encouraging. Not to be, Deputy Downer here, I put some wet blanket on it, but you look at the data from the Ministry of Health, you find that 2.5 million Malaysians today are living with 4 risk factors or non-communicable diseases.
Heart disease?
Actually, no. It's
diabetes?
Diabetes, hypertension, high cholesterol, obesity. 4.
Oh, but all this can lead to heart complications.
So
all of this can lead to heart
Yeah,
complications.
so 250,000 are living with these 4. 2.5 million are living with at least 3.
Oh.
So that is huge.
That is
and
huge.
it's very,
Yeah.
very expensive to treat. And they depend on the public healthcare system. 70% of the Malaysian population depend on the public healthcare system. And that costs us, I think the Minister of Health recently has mentioned, non-communicable diseases like diabetes, hypertension, cardiovascular disease, heart disease, chronic kidney disease, like buah pinggang, penyakit buah pinggang, so forth, cost 64 billion ringgit per year in terms of direct and indirect costs, in terms of productivity and so forth. So imagine that the cheapest way is to prevent rather than to cure.
Yeah.
So look at the healthcare, not the sick care.
Yeah,
We are looking into the sick care.
preventive health, not sick care, but preventive health. Yeah.
But yeah, you were mentioning that it's sakit orang kaya, but I also think that it's also sakit orang not so kaya, because healthy food like your vegetables and things that are that's good for you, okay, it's expensive in this country. I mean, I think people things that are cheap is like maybe rice, sugar, and all those basic things.
These are the subsidized.
These are the subsidized food.
But let me say this to you, that when we look at the profile of people living with these conditions now, in the past, it would be unheard of to hear anyone below the age of 40 to come down with a stroke.
Yeah.
People to be having heart disease or heart attack below the age of 40. Now we hear it quite often. Young stroke is what we're seeing. More and more people are getting younger, and it's not orang kaya anymore. It's across the board.
Yes.
Yeah. Healthy stuff is expensive in Malaysia. I know a lot of people will say, no, it's not true. Food is cheap and everything. But what kind of food is cheap?
I mean, hopefully, there is some silver lining to this discussion in a sense lah. I mean, stepping back to the whole bigger picture here, because we're talking about how we can interact better during this festive period, but also looking at our limits that allows us to have freedom of having to socialize in that sense. Because we're talking about initially the movement, then we go into health, right? But also there is accessibility to what we can gain. I mean, earlier we mentioned a bit about BUDI95. Our Prime Minister has actually announced that with the whole BUDI95 program for this year, 2026, we're expected to save about 2.6 billion ringgit, correct me if I'm wrong, from the savings. So how should this allocation be targeted? Right? Like, where do we look into first? We go to Dr. Ida and probably then we go to Azrul in terms of the hopes and wishes.
Coming back to what you say, something like a reform in the healthcare industry, like Azrul mentioned, probably we can look into some of the countries and which we can emulate. For example, in Japan, because when we talk about healthcare, it's not just Ministry of Health. Ministry of Education plays an important role too. For example, in Japan, when the children they are at the primary schools, right, they are being taught to what to eat. So that's why the food in the canteen actually being prepared by a special person with a dietitian. I mean, it's not that the children can buy anything at the canteen what they want, and sometimes outside the school also somebody is selling this junk food, so to speak. But in Japan, they put it a must for young children, and they train them from the very beginning. Probably we can emulate Japan. We can use that 2.5 billion, for example, to do some sort of reform. To me, this kind of reform, when we are shifting from the sick care to the preventive health, we must include other ministries too. I mean, it's not just Ministry of Health. In fact, probably we can use that money to give to the society, to the public. You talk about infrastructure before, Alina. I mean, for people to actually have some space for them to exercise, for example, because sometimes they can't even see a space. They want to sell that place to a developer to build houses. I mean, sometimes you have too many houses. We have a numbers here, the hanging house, not being sold out. So this kind of thing needs something like a concerted effort by all ministries, to me, in terms of the planning and also the policy.
We have to remember that this year's budget was actually a deficit budget. So we're spending more than we're actually bringing in. And that savings that was mentioned by the Prime Minister actually has already been spent on SARA. If you remember SARA, I think it's around 2 billion. And one of the key issues here that we try to highlight is the fact that Malaysia is one of the few countries in the world which currently subsidizes sugar. And when we subsidize sugar, we are spending 400 to 500 million ringgit per year to make the price of sugar artificially cheaper by 1 ringgit. And this is sugar. We don't need sugar to live, but we are doing it right now. If we got rid of the sugar subsidy of 400 to 500 million, we can use this money for other things and to support healthy breakfast programs, for example. We're talking about prevention, starting earlier with children and so forth. We can fund programs that help educate people to also take up more healthy food, make it much more affordable. But there is no reason for us to subsidize sugar. We really say that we should take away the subsidy.
Right. Okay. Sugar specifically, I do agree. Only because my father's diabetic, and I'm also trying to personally cut sugar out of my diet. But do you think the ministry's approach, thus far, having to with the whole camping zero gula, I forgot.
War on sugar.
War on sugar, and meaning in hospitals not having to serve their drinks or food with sugar is good enough? Or do we need to go more on the ground, for instance, like how we look at the UK in the past, having to have even like their celebrity chef, like, Jamie Oliver, having to go into school canteens and changing the diet, even our school canteens. Do you think there should be more engagement such as that?
There's a lot of engagement. There's been a lot of work in this area for quite a number of years, and I'm very heartened and encouraged by the positive messaging that came out to ensure that in hospitals, public hospitals at the very least, you don't serve garbage or junk food. The most popular thing, I don't know, and I'll be very unpopular to say this, the most popular thing to buy at a hospital co-op shop or cafeteria is waffle hospital, because the hospital's waffles are amazingly delicious because it's very high in calories.
What you have been deprived.
Really, yeah. It's a little bit of guilt food, But basically, we should start with the hospitals. How can you have unhealthy food being served in the hospitals when we're supposed to try to get people to get well, right? So we should start the standard there. at the same time, we have to recognize that people have a right to eat whatever they want to eat. We can't be, fascist about it and try to decide how people should live their lives. But the point here is that people are trying. People are trying hard to be healthy, and we need to help encourage that. And right now, sugar is made artificially cheaper, so that arguably it's to ensure that the makcik who's selling kuih over there can sell kuih. But this is actually a fake description, really, because the makcik can cut down on the amount of sugar that she uses in the kuih and still sell kuih, and I'll buy it from her too. But the point right now is that the argument to continue the subsidy of sugar is right now seemingly for the benefit of the low income or the B40 groups. But actually, the ones who are falling ill in large numbers today are actually in the lower income group. So in order for us to be able to do something about it, we can do something today. Right now, we don't need a law. We can just get rid of the sugar subsidy.
Right. But I also think that, looking back, yes, we all need to be healthy, but I often find that it's more expensive to be healthy than it is to be unhealthy, because the unhealthy food is very accessible. Your nasi lemak is cheap.
The waffles are cheap.
Your waffles are cheap, right? But you try getting an avocado?
Yeah.
Oh, okay lah.
Then not-
Wouldn't be so last will see.
That's avocado.
But anyway, your vegetables, your fruits. Okay, I'm so I'm saying avocado. Totally, first world problems. But okay, like your fruits, for example, like to actually go and have, like to go to the your local markets and to get healthier food or even more vegetable, it costs a lot more. So it all comes down to this vicious cycle, because here you are telling people, yes, you have to be healthy, you have to cut down, you have all these public health announcements and all these PSAs, but at the same time you are subsidizing things like sugar, like what you said. So
No, the economics of being healthy is really not emphasized enough, because people talk about, you have the suku sparrow, the quarter plate thing, where you have half is vegetables and fruits,
your protein,
quarter is protein, quarter is carbs, right? But how much does that place cost? That's
very
the tricky.
expensive.
Yeah. So today, when we talk about being healthy, we also have to acknowledge and deal with the realities or the economics of making that choice. And for a lot of people, especially in places which are very expensive to live in, like Putrajaya, for example, you have problems of malnutrition because the cost of being healthy is very high.
But you see, the thing is, funnily enough, right, all what we've talked about actually comes down to maybe the same type of issues. Like, for example, being sedentary and sitting in the traffic jam for so long, being, eating healthily, not walking enough because there's no proper pedestrian walkings. So everything is like a circle of life,
And this particular circle of life, unfortunately,
has
has
to
to end.
brought to a close.
Brought to a close, because we've actually reached the end of the show. But of course, just one last just takeaway from our guests here, because we talked about, in terms of our freedom to access a lot of things, right? And healthcare, whether it's healthcare, transportation, other things, essential goods, right? At the end of the day, what we want to also highlight is whether or not we are able to practice resilience and self-restraint, which we earlier talked about when we introduced the show, because it starts from home and it starts from the individual, right? So your hopes and wishes to our audience in terms of how they can exercise their mental resilience or self-restraint better. We go with Dr. Ida first, and then we go to Azrul.
Try to reduce this consumerism kind of thing, because it comes to us, to the social media, on TV, right? There are so many things people push to us to buy. Sometimes we have to practice our self-restraint for that matter, and to see what is the most important in our life.
Stop buying cars.
Yeah, no, buying, but definitely like looking at the impulsiveness, the level of it, whether you are buying it because you need it or because you want it. Azrul?
Can you imagine the carbon footprint that we must have? Especially since we have so many cars on the road. But for myself, I think the Malaysian people, they are incredibly resilient. We've seen that during the COVID crisis, and we've seen what we can do when we are able to put our mind to it and to be able to not just survive individually, but also help each other throughout a crisis. The problem right now here is really about what we can do for the next 5 to 10 years in ensuring that we're able to continue to live lives of quality and dignity. And I'm worried about that because the cost of living crisis that we're currently going through, the challenges that we have in terms of bringing up our families, our children, taking care of our older folks, our parents and grandparents, all of it translates to a situation where we now hear during festive season, older folks are being dumped at hospitals, during that period and then collected later on. I never thought I would ever see that in Malaysia, but apparently it started to appear over the past couple of years. So all of this speaks of desperation in terms of how we need to go through this period. So we need to look to each other for solutions. We have to help each other. And most importantly, we have to acknowledge the realities in order for us to address these problems and come up with solutions. And I think the economic situation here right now isn't as bad as some countries. And we definitely can do better than what we are currently doing right now.
It just takes a little bit of thought and care, right? And some sort of
Working together.
responsibility. Yeah, working together and the sense of responsibility and accountability lah, in having to create a more I suppose a holistic sort of environment here. Right, that's all that we have for today's episode. I'd like to thank our guests on set. Thank you so much. First up, Dr Ida Md Yasin, thank you so much for your insights. And Azrul Mohd Khalib, thank you so much for yours too. To our audience, if you do like this particular episode, don't forget to like, comment, and subscribe. Don't forget to also turn on the notification bell if you haven't already. You'll not only get NSC Beyond the Headlines update, other NSC Online's news report will be delivered to you. Now, of course, if you do want to revisit the discussion on set, we're not only on NSC Online's YouTube channel. You can also follow us on our social media. We're on X, Facebook, Instagram, Threads, as well as TikTok. I'd like to thank Alina Koshi for being my co-host.
Always a pleasure.
And to everybody, let's just look at the camera and just say Happy Chinese New Year. 1, 2, 3. Have a Happy Chinese New Year. My name is Amalina Kamal, and I'll see you next week.